I'd like to invite my colleague up, Dr. Natasha Schaefer Solle, for our closing message. We have a special treat for you, a special message from our Assistant Director of the State Fire Marshal Office.
All right, so we're closing out the day. Thank you guys all for being here. So online, live, we have the Assistant Director from the State Fire Marshal's Office, Assistant Director JoAnne Rice. Hi, JoAnne, you're on, and she's live.
Well, good. Okay, great. Good afternoon, everyone. Wow, you guys must be exhausted. It's really been a long day. I think you're like ready for me to get off the screen for sure. But I really wish I could be there with you. It's been I've been a busy week up in Tennessee, but wish I could be there today with you guys and also tomorrow for the Dolphin Cancer Challenge. Would have been fantastic. But know that my heart is there with you. But I do want to talk a little bit about what's on the screen there, the 30 In, 30 Out podcast. This is a collaboration between University of Miami Firefighter Cancer Initiative and the State Fire Marshal's Office. So excited to be able to bring this to you guys. We did our first podcast back in January, but the podcast is about firefighter health and safety. While we focus our first program on firefighter cancer and our second one will be on firefighter cancer, as I said, it's about firefighter health and safety. And so I want to talk to you just real quick about the 26 line of duty deaths that we've already seen this year so far. We're just finishing up February. Those 26 line of duty deaths consist of motor vehicle crashes, cardiac arrests, plane crashes, terrible 5 line of duty deaths, and 2 multi-fatality incidents. We've got to make a change, right? We have to make a change. Those fatalities in Baltimore and St. Louis, those were in vacant structures. So we have to make a safety culture change within all of our organizations. We've got to reach from that firefighter up to that fire chief. So I'm passionate about this. So we're going to be talking about multiple topics over the podcast over the next few months. So we welcome you to join us. You can reach the podcast on Spotify, 30 In, 30 Out, and on Anchor FM. But the 30 In, 30 Out is really about helping you to have tips and tricks that keep you safe throughout your career so that you have a 30-year career, happy, healthy 30-year career, and a happy, healthy 30-year retirement. That's my goal for each and every one of you. And it takes each one of you to buy into that, buy into your own safety, to make sure that you're prepared, because that preparedness equals resiliency. Every little bit counts. One of the previous speakers was talking about the clean cab concept. And while not all the trucks are done and not everybody can do that all the time, every department, it's every little bit counts, every little bit of every step, everything that you can mitigate along the way help keep you safe. We all have those stories of our friends, our family members. We've all been touched by cancer. We've all been touched by some of these other line of duty deaths. And we need to make sure that we continue to be resilient and that we build a strong culture of safety, that we make that change. And when I ask you to make a culture of safety, I'm not saying that you can't be aggressive. I'm not saying that you can't do your job. What I'm saying is that you have to know your job. You have to be prepared to make decisions, conscious decisions when you do things. So I want everybody to stay safe. I got to say, Dr. Kobetz, Dr. Caban-Martinez, Dr. Schaefer Solle, Chris Bader, Sam Eaton, and the list just goes on. You guys are rock stars. But I got to say, it takes each and every one of us to buy into it. It's everybody's fight. Cancer and safety is everybody's fight. We got to continue to do that. So thank you. Our next podcast will hopefully be coming out the end of March. We're looking at doing a podcast on skin cancer. It is one of the most prevalent and destructive cancers to firefighters. So we're going to have a conversation about that and hopefully give you some tips to make sure that you avoid that. So join us on, like I said, on Spotify or Anchor FM, 30 In, 30 Out. Alberto, I do want to thank you for wearing that nice gator blue jacket. I'll give you a shout out for that. I love you for it.
She's killing me. I won't hold you to that, JoAnne. I won't hold you to it.
All right. I'll turn it back over to you all. I miss you. Wish I could be there with you. Know that I'm in there in spirit. And y'all be safe tomorrow.
Thank you. Thank you. You going to do the video? Okay. Go for it. No.
All right, so now it's really the last thing before we say goodbye. So you guys know tomorrow is our event, the Dolphins Challenge Cancer. It's it is the largest fundraiser run by an NFL team. all proceeds go to cancer research. We've had a firefighter team for the last 5 years where we have usually about 100 firefighters that walk the 5K in full bunker gear. And each year, Sylvester does a story, a personal piece, and this is this year's story.
I was doing a routine physical over at the fire department. My labs came back a little bit irregular. When they told me I had cancer, I was like, well, that came out of left field. My initial reaction was mainly fear of the unknown. How long did I have? How long was I gonna be there for my kids? I am a father, a husband, a son, a firefighter, and a cancer survivor.
Multiple myeloma is the second most common blood cancer that happened in about 35,000 people in the US. We still do not have an established curative treatment for myeloma, but we have made a lot of progress over the past few years.
I would say the progress has really existed in two major areas. One are targeted drugs, gentle chemotherapy or targeted drugs, and the other is in the field of immunotherapy.
The combination of medication that he put me on is what saved my life.
David put his head down, plowed right through treatment like a champ, dealt with adversity and setbacks with a lot of positivity, and really did wonderfully throughout the course of his treatment.
His method of treating me and the drug of choice, I was pretty amazed as to how much better I felt, and that actually gave me the hope that things were gonna be okay.
Funding cancer research has gotten more difficult over recent years. Getting federal grant funding has become more challenging, so more and more clinical research programs like mine and others at Sylvester rely on philanthropy. And the Dolphins Challenge, cancer being the single biggest fundraiser for our institution. And they're off! Take them away! All of the money goes directly to cancer research and therefore directly to improvements in patient care.
I was introduced to the DCC by our department PIO. When I found out how big of an event this actually was, I made the decision, like, you know what, I think this might be the perfect time to let people know about my diagnosis. I really had no idea that so many firefighters were being affected by cancer at this higher rate.
It's been known for some time that first responders, like firefighters, have increased cancer risk, and there's been really incredible research done here at Sylvester looking into the underpinnings of that.
As a physician scientist, the observation that first responders seem to have a higher risk of developing multiple myeloma has really motivated me to better understand what's going on. Why is this happening? If we could figure that out, we could prevent this from happening.
Research is our lifeline. Research is what keeps the ball rolling to trying new things.
We can bring all the smartest people and we can continue to build the strongest teams, but without access to resources, we cannot really take it to the next level.
I know for him and for other patients, getting to participate in this, getting to have a direct involvement in raising money for this institution for treating cancer patients, I know a lot of them really appreciate that, and I know David himself felt great about his involvement.
When I showed up that morning at the Hard Rock, I saw firefighters, you know, in their gear. The amount of people that I saw there, actually, I started crying, you know. It was a rush of emotion that just came because I guess at that point, I realized I wasn't alone. After last year's race, I made it my mission to learn as much as I can, help out in any way as I possibly can.
We are all in it together. We are working together towards the same goal. We are trying to seek a cure for multiple myeloma, and we are working together towards that goal. I think we are not that far away from reaching a cure for patients with myeloma. It may not be for every patient in the beginning, but over time, I'm sure we're going to get there. And for the first time, I think it's within reach for us.
David, I recall very well when we first met, and I understand what kind of stress you and your family were under. You handled every bump in the road with dignity. You plowed through it. You got to the other side. And now you're living your life, hiking, being outdoors, being with your family. And you're an inspiration to me, the nurses, and everybody else involved in your care.
So if there's one way I can describe Sylvester, that's hope. Hope is what keeps us going. The hope to live longer, the hope to see our kids grow up, to make it to your next wedding anniversary, or whatever keeps you going. I think hope is that one thing that all cancer survivors and people diagnosed with cancer all have in common is hope. And I'm very grateful for Sylvester Comprehensive Center to give us that light at the end of the tunnel.
So we are thankful to all of you for joining us these past 2 days to have a conversation about how we will extinguish cancer in the fire service. Use these moments, use this time to share what you learned here with your fire departments. We hope that you can join us tomorrow at the Dolphins Cancer Challenge. Before I close, I want to thank all of our sponsors that were with us these last 2 days, particularly our top 2 sponsors from Twin Strand and Gene Tech. Without your support and continuing encouragement of this research work, we would thank you. To all of our attendees, it's been an extra long day. It's Friday night. Bienvenido a Miami. Enjoy the atmosphere, enjoy the weather, and we'll see you again in 2023. Thank you. Close the program.